Good afternoon, sirs and mass. I want to sincerely welcome you to IAMRAT seminar series, the very first in the year 2026. We had wonderful moments last year, and I'm sure that this year we will have better moments. I believe it's not too late to wish us a happy new year and saying that it's going to be a year of wonders for us. Let me run us through a few things about the Institute of Advanced Medical Research and Training, IAMRAT. The institute was established in year 2000 as an administrative purpose and recognized by the National University Commission. It is a response to redress the institutional capacity in Nigeria for strengthening training, research, and policy development in the area of health. This has had a track record of excellent research in international standard channel towards relevant local and global health problems. This has had a complement of trained staff with expertise in many fields of studies. I'll just mention a few of them: malariology, epidemiology, biostatistics, cancer research, drug research, genetics, entomology, neuroscience and aging, with funding from several international and local agencies. Over the years, the scope of research activity introduced has increased tremendously. The facilities of the institute are being utilized by postgraduate and occasional undergraduate students of University of Ibadan and other universities in Nigeria. The institute also assists in the training of more than 10 PhD and 20 MS students annually, registered in various departments in the university. And there is a growing need to strengthen the College of Medicine, the training of postgraduate students in contemporary biomedical and research techniques such as molecular biology and biotechnology and complement training efforts of other departments in the university. And the institute
would inform us of the current issues in this area of co-creation and community engagement as a translational tool in global health. I want to thank Professor Oyeduni Sola Arulogun for giving us her time. We know she's very busy even at this time, that she's now a Vice-Chancellor of a highly rated university, the Chrisland University. So she would be introduced soon. But before I stop, I cannot but quickly recognize our very senior colleagues that have joined us. And even the important ones too that have been in the government, important stakeholders. I can quickly, right looking at me is the name of Professor Isaac Adewale, our highly esteemed teacher, role model, provost of the College of Medicine, former provost of the College of Medicine, former dean, former minister of health, and now an ambassador of this great country, Nigeria. Professor Adewale, we are all here today because of what you have impacted on all of us. And we are happy for your progress. We are very happy for where you are now and for still mentoring many of us and putting them in high places. We pray that God will continue to bless you and would grant you a successful tenure in your ambassadorial assignments. We also have Dr. Mrs. Otolori, Professor, sorry if I have not mentioned your name. I'm just trying to scroll down because everyone is important, but please just pardon me. We have Professor Emmanuel Otolori. He's been very, very faithful, consistent, joining our IAMRAT lecture. We're very grateful for being here with us again. We have Professor Shoyonwo, Professor Komolafe, so many people, our legends of the College of Medicine. You are all welcome to this January 2026 IAMRAT lecture. And so is every other person. Thank you very much. I will hand over to Dr. Adeniji to continue moderating the session. Thank you.
Thank you, ma, for that opening remarks, ma. I would like to invite Dr. Bakari to read the profile of our lecturer for today. Thank you.
Good afternoon, everyone. My name is Dr. A.S. Bakari from IAMRAT. I'm to read the profile of Professor Oyeduni Sola Arulogun. Professor Oyeduni Arulogun is a distinguished Nigerian academic and public health expert, renowned for her significant contributions to health policy and health system strengthening in Africa. She has received training in addition to her basic academic degrees, namely Bachelor of Education, Master of Education, MPH, PhD at the Margaret Sanger Institute, South Africa, London School of Hygiene and Tropical Medicine, Galilee International Management Institute, Israel, and Harvard T.H. Chan School of Public Health, Boston, USA. With his strong background in health promotion, Professor Arulogun has focused her research and practice health outcomes and addressing health and child health, infectious diseases, and social determinants of health. Her approach highlights how factors such as housing, education, and transportation intersect with health outcomes, advocating for a holistic view of health that transcends traditional boundaries. Professor Arulogun's leadership and expertise have earned her recognition as a pivotal figure in advancing public health initiatives and influencing health policy on both national and international stages. A fellow African Academy of Sciences, fellow Royal Society of Public Health, UK, fellow African Institute of Public Health Professionals. She is the immediate past director of the University of Ibadan Center for Entrepreneurship and Innovation, University Orator, and was a member of the University of Ibadan Governing Council. Professor Arulogun is the current Vice-Chancellor, Chrisland University, Abeokuta, Nigeria. Please join me in welcoming our guest lecturer for the month, Professor Sola Arulogun. Over to you, Prof.
Very much. Hello. Can I be heard?
Yeah, we are hearing you, ma. Please
Okay,
share.
thank you very much, ma'am.
You're welcome, ma.
Okay. The Director, Institute of African Medical Research and Training, distinguished elders on this webinar, His Excellency Professor Isaac Folorunso Adewale, Professor Adeyinka Faluyi, Professor Laitonjoyo, Professor Tolori, Dr. Tolori, and other distinguished elders that thoughts on co-creation, not as because so this is me. I'm a professor of health promotion and education of the University of Ibadan and on loan to Chrisland University. So this is the outline we are going to follow. We will look at the terms. We will look at what co-creation means.
Yeah, please be patient. I think there is a network internet connectivity challenge from the speaker's end. So let's give her some time. I'm also trying to let her know about this. Thank you.
So while we're waiting for, okay, Shegun, what's the name now? The IT, please, could you unmute Shegun Adetipe? Sorry if the name is not called correctly. Can you unmute Shegun Adetipe? Please, IT. Oh, Adetipe. Let me work on that.
Okay, thank you, Ma. I'm switching system. I don't know what happened to my system. I'll share my screen shortly.
While Professor Arulogun is still trying to sort out the internet issue, may I use this opportunity to wish every one of us a happy and prosperous new year. We are very grateful for your support over the years. It's been very supportive of you. You have encouraged us. Even some of our audiences have indicated their interest in presenting lectures for the Institute. We are very grateful for this, and we are keeping records. And as soon as we have the opportunity, they will be invited to also be part of this lecture series. We are also very grateful to our legends I've mentioned before. Then to those who actually have joined for one reason or the other, especially our international audience over the years. We've had people from all over the world joining us, depending on probably their area of interest or their collaboration with the speakers at some point. All of this is actually one of the reasons for the IAMRAT lecture, so that everyone comes together as a village, whether you're a collaborator or you are in the area, the field of the lecture. All of this brings like minds together, and we appreciate all comments that have helped us to improve this lecture series. I thank you very much, and I wish you all a happy new year. So I think our lecturer is ready now. Professor Arulogun, are you ready?
Yes, ma. Is my screen visible, ma?
Yes, we can see your screen, but you can make it to be slideshow.
Yes, I'll put it on slideshow now, ma.
You're welcome. Thank you.
Okay, thank you, ma. I apologize again. So I was defining creation, that co-creation is practice of designing solutions with people, not for them. And it's where expertise meets experience, and neither sits at the head table. They are co-partners. In simple terms, communication says, here is the answer. Co-creation asks the question, what do we build together? At the beginning of co-creation, it's slow, but faster towards the end. So co-creation means the problem is jointly defined, the solution is jointly designed, and when that happens, ownership is shared. Both success and failure belong to everyone involved. And in the process, there is mutual learning. So what co-creation is not? Co-creation is not consultation after decisions are made. It is not translating prepackaged messages into local languages, token representation, or just ticking participation to say, oh yes, I involve them. These are what co-creation is not. When we talk about communication is the process of sending information from one source to another, intent of being understood. And in its simplest form, it answers the question, how do I pass across? So when we talk about communication, it has 4 key elements: the sender, the medium for which the message is being sent, the receiver, the message itself, and the feedback. All of these are important for communication to take place. A breakdown in any of these
results in miscommunication, either confusion or confirmation of what the message was meant to be. So in practice, especially in health and development, communication often looks at talks and campaigns, posters, flyers, radio jingles, guidelines, policies, protocols. It is typically expert-driven and unidirectional. Even when we allow for feedback in communication, the source on one side is by the experts. And it has its own limitations. It has its strengths. When you talk about sharing, it's useful in emergencies and standard procedures, but it's limited in terms of the fact that you understand the message does not guarantee that that message is accepted. When that message is not accepted and is not internalized, then behavior change is not likely to occur. So creation of awareness with communication does not equal behavior change. And messages can travel far with communication, but still miss the point. For example, the ministry says, wash your hands regularly. The message is clear. But if water is scarce, if behavior will not change, even though we are aware that washing hands will keep us safe. So communication transfers knowledge, does not automatically transfer to ownership. And that is why we say that communication informs, but co-creation transforms. Another key term we look at is community engagement. It is the intentional, ongoing partnership with institutions and communities to listen, learn, and act together on issues that affect their lives. So when we talk about community engagement, we are not talking about town hall monologue. It is a shared conversation with shared consequences. And there are principles of community engagement, some of which that it power resides in the people, resource is shared, there's emphasis on its find involves all partners. So community engagement means respect. We recognize community knowledge as expertise, not anecdotes. Participation, we involve people in decisions, not just informing them after the decisions have been taken. It involves partnership, shared responsibility, and ownership. And at the heart of community is trust. And that trust is built over time from respect, participation, trust is. And in development, community engagement turns varies into co-producers. The interventions are locally owned and the short-term projects are changed into lasting. When community engagement, it does not improve outcomes. It brings about change in relationships. Translational tool, on the other hand, is anything that helps move knowledge forward from theory into real-world action, from what we know to what we do. Translational tool is the bridge between discovery and delivery. Translational tool converts evidence into practice. It adapts knowledge to context, culture, and capacity. It reduces the gap between policy, research, and experiences. And it makes innovation usable, not just publishable. In the global health context, a translational tool ensures that research findings are understood, interventions are acceptable, programs are implemented correctly, and outcomes are sustained over time. So translational tool turns knowledge into movement. When it's used as a translational tool, evidence doesn't just travel, it takes deep roots. And these are examples of translational tools, such as clinical guidelines, training manuals and job aids, community engagement and co-creation processes, pilot projects and implementation frameworks, decision support tools, and care pathways. So what does co-creation mean in global health? Co-creation in global health means working in equal partnership with communities, practitioners, and policymakers to design, implement, and refine health solutions, ensuring that knowledge moves from evidence to everyday life faithfully, fairly, and effectively. At its core, co-creation means from target population to partners, because we co-define the problems and not just on the receiving end. It means from knowledge transfer to knowledge blending, where scientific evidence meets local wisdom, culture, and lived experiences. Neither dominates, both spectrum matter. From programs to processes, co-creation is continuous, starting with the design, the testing, the learning, and adaptation. They all happen together. And it means from power held to power shared, where decisions are shared jointly with transparency about what can or cannot change. Why does it matter in global health? Global health challenges live in complex social systems. So co-creation ensures that interventions are culturally grounded, ethically sound, trusted and adopted, sustainable beyond funding cycles. Why co-creation matters? It matters because from experience, all of us in the room, we have experienced persistent gap between research evidence and community impact. We have also seen that one-way communication often fails to change behavior, because yes, we can raise awareness, but it's not going beyond the level of awareness or knowledge. It's not translating to behavior change. Also, it matters because communities are essential to translation. They are not just optional audiences. It improves relevance. It increases trust and uptake. When people trust, when people are part of it, then they support what they have built themselves. And when they support what they have built, when they make use of what they have built, it enhances sustainability. So when the funding cycle ends, the program continues because the resources at the community level have been involved. Everybody was part of that process. And it shifts power to partnership, where everybody reduces waste in global health interventions. For example, a health team designs a nutrition program. Using just communication, there are posters developed to say, mothers, feed your children this particular kind of food. But mothers are not going to do that. But co-creation, when mothers, the grandmothers who are key stakeholders, who are key gatekeepers in terms of what food is served children, and local cooks who prepare school meals, when they all come together to redesign meals using available foods in the community, putting the cultural norms into play as well as seasons realities, what we find is that there will be better adherence to the message developed through co-creation, better outcomes, and zero surprises. On the continuum of translational experience, the first level is that the community is involved in raising the research questions. Design the interventions with the experts. The community lead the implementation. The community is at the forefront. They are the driver's seat, and the experts stay behind. They allow the community to drive it. And the highest point is sustained population impact, because they see it as their own. They have used their resources, they have used their time, they have used everything that they have, put it into that intervention, and so it is sustained. Co-creation as a translational tool. Co-creation as a translational tool means intentionally involving communities, end users, and stakeholders at every stage of the research to practice continuum. That is, it's an intentional activity involving people at every stage, right from defining what the problem is to prioritizing problem, identifying the solution, identifying resources within to solve that problem, identifying who and who should represent them, who are the gatekeepers, who are the reference persons that they trust to drive that intervention. So evidence travels with meaning, trust, and momentum. How does co-creation translate knowledge into action? The first, it turns evidence to relevance, because communities help to shape the questions and not solutions. They ensure that the research speaks the language of real life, not just our journals. It closes the know and do gap. When people are involved in developing the intervention, they are more likely to adopt it, they are more likely to adapt it, they are more likely to defend it and make sure that it continues to work. It also accelerates uptake and scale up. Because they have been part of that, it fits into the existing social systems, making implementation faster and sustainability stronger. And it advances equity because power shared, voices that heard are amplified, and solutions address lived experiences. And it works because the translation is not just a handover, it's a handshake. Not, oh, we discovered this. The new language is, we decided together. So co-creation is the tool that ensures that knowledge does not just move forward, it moves together. So how do we make co-creation work in real projects? There are 4 ways we can make co-creation work as a translational tool. We can use the participatory action research strategy. We can use the human-centered design in public health strategy. We can use the community advisory boards strategy, and we can use the measuring engagement strategy. And we'll quickly look at each of these strategies. For participatory action research, it is a collaborative research approach in which researchers and community members work as co-researchers to identify problems, generate knowledge, reflect on findings, and take collective action to create meaningful social or health change. And it has three inseparable elements. Participation, that is, those affected by the issue we are looking at are part of it. Action, findings are used immediately to improve practice or policy. And reflection, we sit back and see what worked. Why did it work? If it didn't work, why did it not work? So in that process, learning is continuous, is cyclical, and shared. Human-centered design is a creative participatory approach that places people, whether they are patients, families, or communities, or frontline health workers, at the heart of public health solutions. Instead of starting with assumptions or policies alone, human-centered design begins with listening, deep listening, curiosity with the human face. And it matters because it has the right answers. It bridges the gap, turning evidence into empathy and empathy into impact. When interventions are shaped by lived experience, uptake improves, trust grows, and outcomes endure. These are the core principles of human-centered design. It's people-centered focus. It emphasizes real-world problems. It's collaborative, it's interdisciplinary, it's iterative, and the design is with. The third strategy is the community advisory boards that advise, that really advise. A community advisory board is a structured group in ongoing partnership with researchers, institutions, or public health programs to guide accountability, realities, values, and priorities. Many of us use the community advisory board strategy, and key features of community advisory boards are representative membership. Those on that board symbolic stand-ins. It plays advisory role, clear influence over priorities, designs, implementation, and evaluation. There's continuous involvement from engagement to planning through learning and adaptation. So right before we start, they are engaged and we think through it together. It's also two-way learning. Institutions learn from context. The communities gain insight and power. And also a key feature is ethics and cultural oversight, which guards relevance, respect, and trust. So what makes community advisory boards real and respected? We need to give them defined decision rights on priorities, messaging, timing, ethics, consultation. Without influence, it's just a polite echo. We need to have the right people on the board, not just convenient people. We need to include those who live with the problem every day. Women leaders, young people, faith anchors, frontline workers. These are people that are living with whatever concept we are investigating. And then early and continuous engagement, need to bring them in at inception, not when the research is concluded. And we need continuous feedback. So they are playing a role of auditors rather than advisors. We need them to project because ordinarily they are on the other side. So training, building capacity of CAB members is important so that, well, an official, so that they can listen to the community advisory board members without being defensive, because wisdom flows from both directions. Feedback is important. We need to show clearly that whatever feedback they are giving us is useful. If we are declining it, we need to explain to them why we are declining. And we also need to respect their time and labor. And we need to do this by compensating them fairly for their time and labor. We need to schedule our meetings with them humanely. We need to respect their time. If it's an agrarian community, we need to respect farm time. We need to respect the context within which we are working. We need to share data transparently, what we found, so that they understand. And we need to explain why we are going to do certain things. I remember one of our projects, we were going to draw blood, and it became chaotic because we didn't take enough time to explain. And what we had was that we were taking 10 bottles of blood from people, and it's like a whole 10 bottles of blood from people. How, I mean, and the person is still alive. So we need to be clear, explain everything to them. So Community Advisory Board is not a one-off consultation forum. It is continuous. It is not a public relations accessory, and it is not a meeting that ends when the funding ends. So it is a continuous process. The last strategy we're looking at is measuring engagement beyond attendance list. It's not just counting how many people came, but we are looking at the actual contribution that was made. So what do we measure? We measure not just the voice. We need to document who is speaking, whose views shape decision. We need to track the diversity of contributions and not just the level of noise that was made there. We need to also document the influence on the decisions that we are taking. We need to document where community inputs altered timelines, priorities, messages, or methods. We also need to document continuity over time. Do people still come back? Coming back, did they bring other people? Or we don't even see them again? Do they make reference to past discussions? Are there sustained presence signals that they have trusted us? Or we can see drop-off signals that shows that our work has a flaw. We also need community members, we need to document the ownership indicators. Which ideas are they initiating? Which sessions are they leading? Which part of the project are they defending? We also need to document the quality of interaction. In terms of the depth of the interaction, are they asking questions? What kind of questions are they asking? Are they bringing solutions on board? When there are disagreements, how did we, together with them, resolve the disagreements? Are there healthy frictions? If there are no frictions, then we are not working at all. How are we able to solve that? And then we also need to measure action beyond the meeting. So we have had a meeting, we have decided what we are going to do, we have mapped out strategies. So we need to track what happens after. Are people still talking about those decisions? Are there local adaptations? Are there informal advocacy? Are people talking on our behalf? what we have brought. So engagement that ends at the door, once we finish and people go and they no longer talk about it, then nothing ever happened. And there are simple practical tools that we can use in measuring that. We can use short post-meeting reflection cards by keeping a small card to document what would you change after this. We can have decision tracking logs showing where input mattered. We can also have participation heat maps that shows us who is contributing, when are they contributing, how are they contributing. And we can also have follow-up interviews or voice notes, not just surveys. Surveys will just give us numbers, but interviews, voice notes will give us the depth of the relationship. What are the challenges of co-creation? The number one challenge is funding. It's time. It takes time because you are going to meet people you don't know at all. I remember we went to a community and we told them we're going to record their voices. I said, no, you can't record our voices because when you go away, you will go with our voice. I couldn't laugh. I had to say, okay, can we do something? Let's record just sweet nonsense that we were talking about. Then we will leave the recorder with you. We will go and come back. If you can still talk, they agreed. So we did mock recording. We played it back. They had their voices. We left it that we went and had to come back again. It was then they believed us that we were not going to go away with their voices. Funding would also be a problem because have funding life cycle, and depending on the magnitude of the program that we are doing, so funding can be a problem, and there can be institutional pressure. Now, the institutional pressure is not only on the research side, it will also be at the community side. I remember a story that one of our founding fathers in the department told me. They went to a particular community. They didn't know that the community had two leaders. Unfortunately, the first time they went, they saw the wrong person. And they had discussed, they had agreed. The day that supposed leader asked them to come, they didn't meet anybody in the village. The whole village was empty. And it's like, it's not possible for a whole village to be empty. Then somebody just came out from so I said, yes, can we help you? Who are you looking for? Sir, we met also the person laughed and said, well, we don't know the person. We then took them to the person they referred, the person they see as their leader. And so they met with that other person. They agreed on another day. When they got back, the whole village was full. So the institutional pressure is both ways. Also, the challenge is another challenge is what type of engagement are we in? Are we doing a tokenism engagement? That is, let them not say I did not involve them, or we are doing authentic engagement. Sometimes we are strapped for time. We want to get things done quickly. And so we tend to go for tokenism because we just put in our report, yes, we related with the community and all of that. It is a challenge. Also, navigating power dynamics and expectations can be a big challenge, as well as align academic rigor with community reality. The community is different. Community is life. Academia, we are in a protected environment. So having to align our academic rigor with the realities on ground in the community can be a challenge. Now, the next thing we are going to look at, in all of this, what is the IAMRAT advantage? The IAMRAT advantage is that IAMRAT is positioned strategically, to train researchers for people-centered translation. IAMRAT needs to begin to build capacity for community engagement research. IAMRAT should position herself as a hub for ethical, impactful, and translational science. That is ongoing, but we need to strengthen what we have on ground. And in all of this, IAMRAT should emphasize that co-creation is not just soft skill that we all need to have. It is a scientific necessity. And as I conclude, I am calling us to action to say that co-creation is about designing for dignity and not dependency. And as we begin to look at using co-creation as a translational tool, we need to ask ourselves 3 questions. Who defined the problem? If the answer is we as the researchers, not we the researchers alone and not with the people, then we are not co-creating. We need to ask ourselves, who shaped the solution? If the answer is we alone and not both of us, then we are not co-creating. We also need to ask ourselves, who owns the outcome? If the answer is, well, it's my research, it's my grant, I have my results, so be it, then we are not co-creating, because the outcome should be such that would bring about a change in behavior. And as I was preparing for this publication was shared with me, and it summarizes everything I've been saying. It is a publication published in Nutrition Intervention, and the title is From Streets to Tables, Bottom-up Co-Creation Case Studies for Healthier Food Environments in Vietnam and Nigeria. This publication summarized everything I've been saying, how the problem was identified together with members of the community, how they designed the intervention, how they started from the bottom and adopted the bottom-up community engaged co-creation processes in intervening within the low, middle, and low, medium income countries, the food retail system. And so when we talk about co-creation, it is from data to dignity. Co-creation is how science crosses into real life. And 4 takeaways. 1, co-creation turns evidence into relevance. 2, translation happens through relationships and not reports. 3, ownership beats compliance every time. And 4, impact improves when power is shared. Co-creation doesn't slow public health. It stops it from going in the wrong direction. Thank you very much. Over.
Thank you very much, Professor Oyeduni Arulogun. I'm sure everyone would agree with me that this has been a very illuminating lecture and well delivered, and to the level of every participant in this lecture. Thank you very much. We're very grateful. We've all learned one thing or the other. So I'll hand over to Dr. Adeniji. Could you continue the moderation? Prof. Ma, thank you once again. We're very happy to have you.
Thank you very much, Ma.
Thank you. Okay, thank you, Ma. Professor Arulogun will moderate the question and answer session. So I would like to invite Professor Akinyemi for that session.
Professor Akinyemi, is he online?
Yes, I'm online. Well, I'm just waiting for me to be unmuted. All right. Thank you very much, Professor Oyeduni Arulogun, for that elegant, excellent, and very rich delivery. Can you please allow me start my video beyond the audio, please? All right. Thank you very much, Matt, for taking us through what I'll call the ABC of or the A to Z of community engagement simplified, and for demystifying co-creation and highlighting the essence, the principles, the techniques, and the impactful approaches to community engagement, and of course, principle of co-creation in research. Thank you so much. Thank you so much, ma'am. So we will now take comments and questions from the participating audience. I want to single out a very eminent leader, former provost of the College of Medicine, former Vice-Chancellor, former Honorable Minister of Health, and now a great ambassador of the Federal Republic of Nigeria, our very early esteemed Professor Isaac Adewale. Thank you so much, sir, for taking time out of a very busy schedule to join us. Amongst other very early esteemed leaders, including the Foundation Provost of our College of Medicine, Emeritus Professor Akode. Thank you so much, sir. I paid due homage to all other esteemed leaders, past directors of institutes, mentors, living legends, and colleagues from the university in Abeokuta, where our speaker is Vice-Chancellor. Thank you so much, Ma, and for all our friends from across the globe, all our research partners. I'm privileged to be one of Professor Arulogun's research collaborators. Thank you so much, Ma, for that elegant lecture. So please, if you have comments or questions, may please post your question in the chat box. Thank you very much. But as a way of starting off the Q&A session, you've given us the principles of co-creation, but I'm a witness that you have lots of experience. You're speaking from the vantage position of field experience, not just theoretical framework. May I ask you, ma'am, if you may just share one or two experiences from your vast experience in co-creation, community engagement across diverse fields of research, from brain research to research on infectious diseases, all across the spectrum. Just one or two examples to drive home the points you have made in your lecture today. Yes, please, ma'am.
Thank you very much, Professor Akinyemi. As I was doing the presentation, my mind went back to my PhD research, and how at the end of the day, I just told myself I was a failed researcher because I thought I co-created that intervention with my study population, but eventually I found I did not. And my PhD was among the deaf, and it was effectiveness of using sign language for the prevention of HIV deaf secondary school students. And I had a group of them trained as peer educators who worked among their fellow peers. And one fateful day, I have them as my friends. So when they knock, I know they are the ones knocking. So I had this heavy bang on my door, and she came in, and I looked at her. She wasn't looking happy. And I said, "What's the problem?" Then she said she had not seen her menstruation, and her boyfriend had given her some tablet to take. And since she wasn't seeing it, she thought the best person to come to was me. And she was one of the educators that was trained. So I asked her, what happened to all the knowledge and everything you had? She said she didn't, the use of condom to unwanted pregnancy. She only linked it with prevention of HIV. And since she believed that her boyfriend was not promiscuous, she didn't think she needed to use the condom. That day, I knew I was a failure, because I had gone away with the euphoria that, oh, we developed signs, because at that time, there were no signs for HIV, for all of that. We co-designed them. And I thought that all the things we were doing, it went beyond knowledge, it went to the real understanding. So that taught me, and that was in 1998, that taught me that it goes beyond saying, oh, okay, come and let's do this together. One really needs to be sure that, do they understand the concept we are talking about? Do they, I mean, is what I have in my mind, is that what they also have? Are we on the same plane? That was one example. Another example at the community level, where we need to be careful when we talk about power, when we talk about institutional pressure. We had this project in the community, and it happened that it was during the political time. Politics was ongoing, elections were coming. And unfortunately, the people at the community that serve like our anchor person happen to belong to an opposing political party. So seeing us with
think, since it appears our speakers lost audio, perhaps internet challenge, perhaps. Are you there, Prof? I think we lost her for a moment. Okay, sir, Professor Tolori, sir, you may please, you have the floor while we're having Professor Arulogun back. Yes, sir, you may please unmute and make your comments.
Right, thank you very much. It's a pity the speaker is not on. I just wanted to share some experience. Many, many years ago, we identified lack of or poverty as a reason for women not attending antenatal clinic and delivering health facilities. Many of them were not coming because of the fees being paid, and husbands were not making these monies available. So that was the problem we identified, and a solution that we introduced was to set up what we call mothers loans clubs, mother savings and loans clubs, where these clubs of about 20, 25 women, most of whom are pregnant, come together and they save small amounts of money, 100 naira, 200 naira. And then when they need to go to a health facility, they can take a loan from the pool of money that has been saved, and then they pay it back over time. That way we remove the barrier of money for not going to a health facility. Now, the reason why I'm bringing it up is that you start something good, and then politicians wanted to hijack it. You know, some politicians now came, they saw that women were coming together, and they went and donated money into the clubs, and they wanted to label them as supporters of a particular political party and so on. It was so frustrating. And we had to, talk to all the clubs to say, look, you must be neutral. Don't allow any political party to hijack the association or the organization for their own reasons. The purpose of setting up the Mothers and Savings and Loans Clubs was to empower the women so that they can make use of health facilities and reduce maternal and newborn morbidity and mortality. I just wanted to share that experience. Thank you.
Yes, sir. Thank you very much, sir, for sharing that very relevant example, developing sort of a cooperative for mothers that empowers them economically so that they can participate, they can attend antenatal clinics more, they can adhere more to antenatal clinic attendance. Thank you so much, sir, for setting that very important example. Thank you, sir. So there's a comment before I call on Professor Odukobe and our past director, Professor Falusi. There's a comment in the chat box asking whether we can turn the World Development Committees, into frameworks for effective community engagement, perhaps some sort of community advisory boards based on representations from World Development Committees. So may I request our speaker to attend to that question, while Professors Odukobe and Falusi are prepared to also make the comments. Yes, over to you, ma'am. What are your thoughts about using World Development Committees, turning them into maybe frameworks for developing community advisory boards?
Thank you very much. My comment is yes and no. It depends on how the members of the World Development Committees were constituted. There are things we know should guide our selection. They should be representatives of the people. They should be approachable. They should not be partisan. And so if the membership of the World Development Committee fits all the criteria of belonging to Community Advisory Board, yes. But if not, no. And it's also not advisable for World Development Committee to be used as Community Advisory Board, because the World Development Committee is like a general body that oversees almost everything related to health in the community. It's better to have CAB that is targeting a particular intervention. With that, is going to be more effective and sustaining than using the large, big umbrella body. That's my thoughts. Thanks.
All right. Thank you very much, ma. No, that was CAB should be purpose-driven. Thank you very much, ma. Thank you so much. All right. So we'll take comments now from Professor Odukobe, then Professor Falusi, and then Professor Neto in that sequence. quick, brief comments. Yes, over to you, sir. You may please unmute and speak. ITU, can you please unmute Professor Odukogbe, please, so that he can speak? Please unmute everyone whose hand is electronic hand is up. Yes, yes, sir. Please, you have the floor.
Good afternoon, Mr. Moderator, and thank you. Thank you, Professor Arulogun, for this beautiful lecture. The first aspect of my comment would be that perhaps if we look at the situation when we are participants in a research, we will be able to understand a lot of what you have said, that we will want to be treated as part of the research and not just as subjects. I've been used as a participant in many researches, and I quite understand being able to be taken into the research. I had an inkling of what you have described to us this evening in 2006 when I was doing a master's program. And one of our lecturers then said that when she was doing her PhD, that she spent 1 full year in the community that she was going to study. She spent 1 year to understand the community before even starting the project. And there's no way she won't be able to understand the community. And a lot of the things you said about lack of deep communication between the researcher and the community, leading to the villagers not being present and things like that, will then be understood, because being in that community for 1 year will make you to be able to understand and then interact better. But it's useful as that is, the challenge is with the present researchers, especially when it is not funded. That, okay, how do you get a PhD student to go and live in a community, fend for herself and himself or herself? So the cost of that, the other challenges with our communities, and the suspicion, so many factors are militating against that simple but very vital effort to understand your community. So thank you very much for the enlightenment. Thank you, everyone.
Right. Thank you very much. Yes, sir, Professor Odukogbe. So we have Professor Falusi, please, and then after that, Professor Aneto.
Thank you very much for the lucid presentation. It's really an eye-opener, especially for the younger generation of researchers, and for those of us already in this business for so long. It also helps for you to remind you that there are certain clauses which you have to continue to take into consideration. And my simple example is that we cannot overemphasize what you have just reiterated to today, because you brought it forth that each of us that has taken part in this research, you find out that if you just do this communication thing, it may not work. And there was an example we had when we were doing a study on malaria in the local Ibadan central place. My partners came from Germany and all those places, and there was a day we had designed, we were going to go to this Eleta and all these other places, and unfortunately there was a strike. There was no traffic. There was no transportation and so on. And we went there, and we found out that we couldn't get more than maybe 2 people. And my researcher said, "But you said this is the center where you usually get many people." And I said, "Well, it is because there is no money and the transportation is very little. It's very more expensive and so on." And they were disappointed. And I myself was shocked that just because of an extra little bit of money, people would not bring their children with malaria. All we then needed to do was to talk to the nurses and the group of the management in two of the local places there. And we explained to them that the reason for bringing these children, if you will bring them next week, we're going to dialogue with you. We are going to give you some transport back. We're going to be able to tell you what to do. And that, I cannot believe it that the following week, this strike was still on. And in fact, when we got to the first clinic, we could not even finish half of the patients that were there. They were there with their children and we hadn't even given them any money. They were there, but because they took this broadcasting, I don't know what equipment they call it, for broadcasting to the different streets to tell them during the week that this group is coming, this is going to happen, this is going to happen. And they were carried along and all of them brought their children. Many of them febrile, many of them with complicated issues, but that same place, we couldn't get them the week before. So I think your explanation on co-creation is so important to researchers to be able to get very good results at the end of the day that will benefit both the researchers and the community. So the community is really, really, really important. The science we are doing is important, but at the same time, carrying that community along, as you said, is extremely important. My second little bit of addition is making up the CABs. Sometimes we have researches that span beyond Nigeria with Asians, Indians, and all those, especially in sickle cell disease, where this is all over the world. But because we Nigerians, we have the highest burden, we have the worst prognosis, we have the highest number, we have all the poverty, we have so many things militating against us. When we form CABs there, I've seen examples of groups that are forming CABs and putting the foreigners, because you say this person is European, and put 70% of the CABs coming from other countries. Instead of us looking inwards, finding the people that are meeting with community and making sure the reverse is the case, whereby those of us who are here and hosting this thing here have all the knowledge of our community. We should not leave that behind and defer to people who have maybe of the problem that we have when we form our CAB groups. We must be sure that the representation not only cuts across the particular disease, but to tell you that what is the contribution of your society where this problem is actually at the foremost in the world. And so when we form the CABs, we have to look at many criteria in putting them in there, not because somebody comes from somewhere else or is white or whatever. So we should balance all these acts before we choose our CABs to get maximum benefit for our community. Thank you very much.
All right. Thank you very much, Ma, for those extremely relevant comments. So we'll take the last comment from Professor Neto, and then our speaker all the way from Chrisland University will then, there's a question in the chat box on difference between co-creation and implementation science. So let's have Professor Neto's comment, then Professor Arulogun will address that question and then gradually work towards rounding up the session. Yes, okay. Professor Neto, sir.
Yeah, good afternoon. Can you hear me, please?
Yes, please. We can hear you very clearly. Yes, we can hear you loud and clear.
Yeah, good afternoon, everyone. Thank you very much, Professor Arulogun, for your lecture. Fortunately, I'm late. We are called the science here in Nigeria. I joined in Translational, which was in creation, and it had a really strong and quite important research. So I do what amendments to change in our environment and how they can be properly mitigated. Thank you. Hello?
Yes, hello,
Hello?
sir. Yes, sir. Yes, hello, we can hear
Hello?
you. But were you asking a question? This sound was muffled, breaking, wasn't very clear, sir. Or do you want to type your comments so that if you want the speaker to respond, I can then read it out and then she can respond to the question that you may have. All right. Thank you, Professor Oyagala from Chrisland University for your comments. So thank you very much. So back to Professor Oluguma, there's a question about any difference between co-creation and implementation science. Do you want to take the question, Mark?
Okay, thank you very much. Co-creation is a strategy to be used in implementation science to ensure that impact is created, to ensure that the intended outcome is achieved. So co-creation is a strategy. It is not implementation science, but it's a strategy in implementation science to ensure that it is the intervention is jointly created by those who are going to benefit from it, so that it is culturally sensitive and accepted, so that the context is taken into cognizance. When co-creation is used, that is when implementation science can be a success, where the outcome is meeting the need and closing the gap. So they are not the same. Co-creation is a strategy. Yes. Thank you.
And there's a very relevant example from our local environment here from Professor Oyagala, how a town crier, just one night, going around the community, almost halted a project that was running for about 2 years. So how can we use that example to drive home the point of engaging with, having a community engagement framework that is locally sensitive to the local cultural practices. Town criers, very important in the environment. So apart from town criers, are there other very important segment that we need to engage in this part of the world to ensure key success and sustainability of a research of community engagement program? I don't know if you got that question, ma'am.
Yes, I did.
On Professor Oyagala's comments.
Yes, I did. Now, first and foremost, when we are going into any community, we need to identify the leadership structure in that community. The leadership structure is key. Apart from identifying the leadership structure, we also need to identify what is the communication channel in that community. Who do people listen to? We need to understand the different interests within that community, because definitely that town crier, his interest is not in line with the project. So what we usually say is that we first of all do what we call community diagnosis. Community diagnosis tells us who the leadership is, the leadership structure, the communication pathway, who are the key gatekeepers of custom, of knowledge, of information. That helps us to know who and who should be brought on board and what information is allowable in the community. Let me give an example. We had this study in Ibadan, Southeast local government. Now, the young people in the community wanted us to design poster educational materials showing condom and how the condom is to be used, appropriate use of condom. We ran that with the elders, and the elders said, sorry, you cannot bring this to our community. Don't come and corrupt our children. Now you can see different opinion, but we cannot have an inroad into the community if we don't relate with the elders. And so we need to study the community to identify the existing structure and the context and what is allowed for us to know who and who to bring in, and then what message to be sent out. That will be my comments. Thank you.
Professor Akinka, sorry, Professor Akinyemi, you are muted.
Oh, my apologies.
Yes.
Right. So, well, I was just thanking our speaker for the excellent reactions to the comments and questions from the audience, following a very beautiful lecture. So thank you so much, ma'am. Well, I would just like to hand over back to our director, Professor Kiajayi, to wrap up today's session. All right, thank you.
Yeah, thank you very much, Professor Akinyemi, for that good moderation of the question and answer time. Thank you once again, Professor Arulogun. Please, before we go, I want to also bring in an important contribution which Professor Arulogun can also allude to. And this is about community entry and community engagement, the other side of it. And what do I mean? It's good. She has mentioned a lot about community entry, knowing who and who, community diagnosis, and so on. But in community engagement, we also need to let our audience know that we should be prepared. And there are some things that the community can actually request of you, which may not be, may not attune to your own either culture or your own way of life. And if you fail in that regard, you may have problem with community engagement. Let me give you this example, and Prof. Arulogun can also attest to it. It was on a project on home management of malaria. And we went to the communities. One of the communities, when we got there, we had a meeting with the community elders and stakeholders. And well, it's not so much a surprise for giving us something, but is the way they wanted us to accept it. So they now went to bring water in a calabash. And they then said, well, we should drink out of the water from that calabash. So the calabash was passed around from one person to the other, and we must drink from it. That was something that was really shocking to me and many of us on the team. But from the messages from our leader, team leaders then, we just had to partake of this communion water. So when we say we are going to the community, we must be prepared. And that is just what I want to tell our people, our participants, and that when you get there, surprises can be pulled up and be ready for it. I want to thank Professor Arulogun for that lecture and for really bringing out the key messages that who decide on the research question, who shaped the solutions, and who owns the outcome. These are key messages that we should go home with and use this when we are writing our proposals. This would really help us to ensure that our outcomes or findings would be would provide an evidence for policy or translation into public health action. And I thank you for challenging us at IAMRAT that we should ensure that we put in a lot in educating and training people on this issue of co-creation for research. And so I want to promise you that we would pen this down. I've actually penned it down for one of our training sessions, which we shall seek your support and advice when we design such training. So on this note, I say a big thank you, and I thank all the people that were on this lecture. It's really, really encouraging for the first lecture of the year to have really attracted so many people internationally, locally. And I want to thank the NGOs and international organizations that were represented on this lecture today, and also all the lecturers and people from different walks of life. We have lay people, we have people from different disciplines, surgeons, ONG, people that will think, oh, what is communication in all of this? They are all with us today. Thank you very much. And I want to promise you another very important and a lecture that stands to be insightful for the next month, February. This again would be taking place the last month of February, the last Wednesday of February, and at the same time, 3 p.m. Please share with your colleagues, tell your colleagues about this wonderful educative sessions that IAMRAT provides monthly. Please, before you go, register using the Google link that I posted on the chat so that we can share lectures, and also we can give you the CME score if you require it. Professor Arulogun, thank you so much for sharing the link to your PowerPoint presentation, to your slides. Please look on the chat. The link is there for those who are interested in having the lectures, the presentation. Please feel free to access this. I thank you all, and we look forward to seeing you next month. To the training crew of IAMRAT, thank you very much for this successful lecture. Thank you, and have a good evening, everyone.
Thank you, Ma. Thanks everyone for coming. God bless you.